With medical providers facing rising levels of burnout, software designers are testing specialized AI-powered chatbots in the hopes of easing the burden of diagnosing, treating, and providing preventative care advice to patients. People can now get short, seemingly authoritative AI summaries from bots like OpenAI's ChatGPT or Google itself. But the answers aren't always accurate, as CBS News Confirmed found out. Here's Major Garrett.
Google search is generative AI at the scale of human curiosity.
This spring, Google unveiled an AI overview feature where answers from Google's chatbot started to appear above search results for many health-related queries.
With generative AI, search will do more for you than you ever imagined. Just ask, and Google will do the Googling for you.
Sounds good in theory. In practice, there have been some glitches. The chatbots shared misguided medical advice that was sometimes comical, sometimes dangerous. In the first week of this new tool's use, one user said Google AI gave her tips for what you do if you get bitten by a rattlesnake that included sucking out the venom. That advice, if followed, could be lethal. The AI technology also gave advice on how to get a weeks-old baby to eat their vegetables. Physicians say infants should not eat solid food until after 6 months of age. Google AI even recommended eating, quote, at least one small rock per day, unquote, to increase vitamin and mineral intake. That advice was lifted from an article in The Onion, a well-known satirical website. Google says it has limited inclusion of satire and humor sites in overviews and removed ones that, for the wrong reason, went viral. A Google spokesperson tells CBS News, for health queries, we've always had strong quality and safety guardrails in place, including disclaimers that remind people that it's important to seek out expert advice. CBS News confirmed that some health misinformation persists on the tool. Queries about introducing solid foods to infants under 6 months old still returned tips in late June when we tested it. Searches on the health benefits of dubious wellness trends like detoxes or drinking raw milk included debunked claims. Despite the quirks and outright errors, many healthcare leaders remain optimistic about AI chatbots.
In the long run, I think these technologies are going to do us a lot of good.
One of them is Dr. Nigam Shah, chief data scientist at Stanford Healthcare.
When Google search came around, everybody was like panicking that, patients will self-diagnose and all hell will break loose. Didn't happen. Same thing, we'll go through that phase with chatbots that, yes, of course, the new ones that are not fully formed will make mistakes, and a couple of them will be bad. But by and large, having information at your disposal when there's no other option is a good thing.
Hi, I'm Sarah.
This is the World Health Organization's chatbot, Sarah. Sarah pulls information from the World Health Organization and trusted partners. But even though Sarah is less prone to factual errors, Sarah's attempts to mimic user facial expressions can be jarring. How can I lower my risk of heart attack?
Focus on a balanced diet, regular exercise, managing stress.
Advocates of chatbots are quick to say that physicians, like bots, can make mistakes. Estimates vary, but a 2022 study by the Department of Health and Human Services found up to 2% of emergency room patients each year may have suffered harm from a misdiagnosis.
Sleep is crucial for heart health. Aim for 7 to 9 hours of quality sleep per night.
With the right design and oversight, AI chatbots might one day give better medical advice and reach more patients in need. But if you are turning to an AI chatbot for health advice today, note the warning that comes with Google's version. Info quality may vary. For CBS Saturday Morning, Major Garrett, Washington.
For folks who need that quick piece of information in the moment, you think this is the place to turn. It's hard to get to the ER. It's hard to get the doctor on the phone.
It's like going on WebMD 10 or 15 years ago.
That,
you go on, I have a headache. Oh, I'm going to die.
Right. I have a tumor.
I think it's just being smart about it.
Right,
As you said, in the long run, this is a good thing.
Yes.
It's just in the short run, I'm not going to probably be eating rocks with my eggs and bacon in the morning.
Yeah.
I mean, you could, but I don't think it's a good idea.
No, and I think it's also think about it if it maybe doesn't sound right or you're not sure. I know it's harder, I know it's longer. Almost so many sites now have where you can have a virtual appointment with a doctor. Try that right now just to back it up, if you can, right? And don't eat rocks.
Do not eat rocks and don't
They are
suck
still the
venom out
doctors.
of
And don't suck
a
the
rattlesnake
venom out.
bite.
Yeah.
Good advice.
I mean, you can, again, but
But there's a
but spit it out.
yeah.